stop. Before you close this app, I want you to do something. Go to a mirror right now or just picture yourself in one. Look at your neck, your eyelids, your palms, the whites of your eyes. Because here's something most doctors will never tell you. Your liver is communicating through your skin every single day through signs that most people dismiss as cosmetic problems, aging, or genetics. Dark patches on your neck that won't wash off, tiny and spider veins on your chest, a belly that protrudes from just under your rib cage and feels firm, not soft, firm. These are not skin problems. These are metabolic distress signals, and your liver is the one sending them. I'm Dr. Max, and today we are decoding the 7 hidden signs of fatty liver disease that you can detect in the mirror from a biological and practical perspective. We are going to connect each visible sign to its precise internal mechanism, and then I'm going to give you the protocols to reversing the root cause. Subscribe if you haven't already, and let's get into the science. Alright, before we go through each sign, I want to give you a mental model that will make everything else click. Think of your liver as the central broadcast tower of your metabolism. It manages your hormone, your cholesterol, your detoxification, your blood sugar signaling, all simultaneously. When that tower is functioning at full capacity, the signals it sends out are clean, precise, invisible, and everything runs quietly in the background. But when the liver becomes congested with fat, then hepatocyte fills with lipid droplets in the condition we now call metabolic associated steatotic liver disease. The broadcast tower starts sending out distorted signals, garbled messages, and those distorted signals, they show up on the surface of your body, in your skin, in your eyes, in the shape of your abdomen. In my clinical observations, patients are often shocked when I point to a skin finding and tell them it is a liver finding. They came in about their belly. They didn't realize their neck was telling the same story. Now, let's go through each signal one by one. Sign 1, the liver belly. You know this one. You've seen it. Maybe you're living with it. But here's what most people misunderstand. A liver belly is not simply excess weight. It is geometrically and biologically distinct from regular abdominal fat. It protrudes directly from under the rib cage. It often feels firm, not soft, and it resists conventional dieting in a way that ordinary fat does not. Here's the mechanism. As the liver accumulates fat, it triggers 2 simultaneous cascades. First, systemic inflammation, which drives the body to professionally store visceral fat. Deep internal fat wrapped around the organs, not under your skin. Visceral fat is metabolically active. It secretes its own inflammatory cytokines, and it's not passive storage. It is an active participant in metabolic dysfunction. Second one is more advanced stages. The congested liver triggers a rise in portal hypertension, elevated pressure in the portal vein system that feeds the liver. When portal pressure climbs high enough, the liver begins to leak fluid into the abdominal cavity. And clinically, we call this ascites. The abdomen feels it distance, and no amount of caloric restriction touches it because it is not fat. It is fluid accumulation driven by a failing organ. The liver belly is not a cosmetic issue. It is a pressure gauge. Alright, the second sign, the dark patches on your neck. Dark, velvety, thickened, appearing on the neck, the armpits, sometimes the knuckles. Most people think this is a hygiene issue. They scrub harder, nothing changes. Here's why. This skin finding, called Acanthosis nigricans, is a dermatological hallmark of hyperinsulinemia. That is the clinical term for chronically elevated insulin levels circulating in the bloodstream. Think of insulin as key. Its job is to unlock your cells and allow glucose to enter. But in fatty liver and insulin resistance, which are biologically coupled, meaning one almost never exists without the other, your cells stop responding to that key. So the pancreas does what any logical system would do. It makes more keys and floats the bloodstream with insulin, hoping some of them work. That float of insulin acts as an anabolic metabolic signal on the skin. It tells skin cells called keratinocytes, and think of them as the tile layers of your skin's surface, to proliferate rapidly. Those new cells carry more melanin, more pigment, and they accumulate in the folds and friction points of the body, the neck, the armpits, the knuckles of your fingers. The dark patch is not dirt. It is evidence of an insulin flood, and the source of that flood is a liver that can no longer manage glucose metabolism efficiently. If you're just joining us or you lost the thread, here's the core takeaway so far. Fatty liver disease doesn't stay hidden inside the body. It broadcasts itself onto the surface through the shape of your belly and through skin changes like dark velvety patches on the neck. Both of these signs trace back to the same root cause, a liver overwhelmed by fat, triggering insulin resistance and metabolic inflammation. 3 more signs to go, and they get more specific. The third sign, spider angiomas, the red veins on your face and chest. Small, red, radiating outward from a central point like spider web, appearing on the face, the neck, the upper chest. This one surprises most people because it looks vascular, and it is, but the driver is hormonal. Here's the mechanism. One of the liver's critical job is estrogen clearance, and every day your liver takes circulating estrogen and metabolizes it, breaks it down, conjugates it, prepares it for excretion. When the liver is congested with fat, this clearance pathway slows. Estrogen accumulates. Estrogen at elevated concentration acts as a potent vasodilator. It relaxes and expands the walls of small blood vessels, and specifically, it causes a small surface arterioles to remain permanently dilated. They can't close. The blood pools near the surface, radiating outward in that characteristic spider pattern. Think of it like a garden hose with too much pressure and a nozzle that won't close. The pressure has nowhere to go, so it spreads across the surface. In my clinical observations, spider angiomas on the upper body, especially appearing in someone who also has central weight gain and fatigue, almost always point me toward hepatic estrogen accumulation. This is not a dermatology referral. This is a liver conversation. Alright, sign number 4, scleral lectures, the yellow tint in your eyes. Look at the whites of your eyes in natural light, not artificial, natural. A subtle yellowish tint, not jaundice level, just a slight warm discoloration where the white should be bright and clear, is called scleral lectures, and it indicates a specific and important metabolic failure. Here's what's happening. Every day, your body breaks down old red blood cells. When a red blood cell reaches the end of its lifespan, hemoglobin is dismantled and converted into bilirubin, a yellow pigmented waste product. A healthy liver captures that bilirubin from the bloodstream and processes it and excretes it through bile into the digestive tract. A fatty liver is slow. The processing is delayed. Bilirubin builds up in circulation, and bilirubin has a chemical affinity for elastin, the protein that gives tissue its elastic quality. The sclera of your eye, the white part, is dense with elastin, so bilirubin migrates there first before it shows anywhere else on your body. The whites of your eyes are the earliest bilirubin detector you own, and they are completely free. Alright, sign number 5. Xanthelasma, or yellow deposits on eyelids. Small, yellowish, and slightly raised, appearing on or directly around the eyelids. These are called xanthelasma, and they are deposits of cholesterol that have leaked into the skin of parietal region, the eye area. Here's the mechanism. The liver is command center of lipid metabolism. It synthesizes cholesterol, regulates how much circulates, and determines how much gets excreted. When the liver is clogged with fat, this regulatory function breaks down. Cholesterol processing becomes dysregulated, lipids spill into circulation in excess and they find their way into the thinnest, most vulnerable skin in the body, the eyelids. Think of it like a water treatment facility that's operating over capacity. The filtration breaks down and unprocessed material starts leaking into places it shouldn't be. If you see these deposits forming, your liver is no longer managing cholesterol. It is simply moving it around. Sign number 6. Palmar erythema, the red palms. Hold your hands out, palms up. Look at the fleshy pads on either side, the base of the thumb, the base of the pinky. If those areas show an unusual redness, a warmth, a blush that seems independent of temperature or excretion, that's called palmar erythema. And like spider angiomas, it is driven by two converting mechanisms: estrogen imbalance and elevated nitric oxide signaling. Then the liver fails to clear estrogen efficiently and simultaneously fails to regulate the nitric oxide pathways that govern vascular tone, the microvasculature of the hands, specifically in those thenar and hypothenar regions, becomes persistently dilated. Blood flow increases, the surface warms, the tissue reddens. It is the same broadcast tower sending the same distorted signal just through a different antenna. Alright, the last sign, skin tags. The metabolic growth signals 3 or more skin tags on the eyelids, neck, or chest. Not 1, not 2, 3 or more. Research consistently demonstrates a direct correlation between multiple skin tags, clinically called acrochordance, and metabolic syndrome. And the mechanism is elegant in a troubling way. Chronically elevated insulin and IGF-1, insulin-like growth factor 1, a hormone closely tied to insulin signaling, act as anabolic triggers in soft tissue. They instruct skin cells to grow, to proliferate, to form these small pedunculated outgrowths. Think of IGF-1 as a volume dial on a speaker that controls cellular growth. In a metabolically healthy person, that dial is turned to moderate, regulated setting. In someone with chronic hyperinsulinemia driven by fatty, insulin-resistant liver, the dial is turned up, and the skin responds by growing where it shouldn't. 3 or more skin tags is not a cosmetic pattern. It is a metabolic fingerprint. Let's pause and connect the dots. 7 visible signs, 7 different locations on the body, but every single one traces back to the same failing organ. A liver that congested with fat, overwhelmed by insulin, unable to clear estrogen, and losing control of cholesterol metabolism. This is not 7 separate problems. This is one problem with 7 faces. Now, let's move from the why to the how. The root cause analysis. The root cause of every sign we just discussed is not a skin disorder. It is not a hormonal disorder in isolation. It is not a cholesterol disorder. It's a hepatic metabolic dysfunction driven by fat accumulation in the liver. And the primary fuel for that fat accumulation is one thing above all others: chronic hyperinsulinemia. Insulin is the master storage hormone. When insulin is chronically elevated, driven by a diet high in refined sugars, high fructose, corn syrup, and ultra-processed carbohydrates, it activates a process in the liver called de novo lipogenesis. Your liver literally manufactures fat from excess glucose and packages it inside its own cells. And over time, those hepatocytes, your liver cells, become lipid-loaded. The metabolic functions we just traced across all 7 signs begin to fail. Estrogen clearance, bilirubin processing, cholesterol regulation, insulin signaling. They all degrade together. And the visible signs on your body surface are the latest stage communication of that internal collapse. The goal of intervention is not to treat the signs. It is actually to defat the liver by addressing the root hormonal driver, insulin. Alright, let's talk about the protocols, and I'll start with protocol 1. Lower the insulin load immediately. Remove refined sugars and high fructose corn syrup from your diet without exception. reduction because these are the primary substrates driving de novo lipogenesis, your liver's fat manufacturing process. This is not a gradual reduction. It is a complete elimination. Remember, read the labels. High fructose corn syrup hides in condiments, sauces, flavored beverages, and processed foods marketed as healthy. Every gram of it is a direct instruction to your liver to store more fat. Protocol number 2. Activate autophagy through intermittent fasting. Alright, autophagy. Think of it as your liver's internal recycling and self-cleaning program is activated when insulin levels drop to their baseline. The most efficient way to achieve this is through a structured intermittent fasting protocol. A 16 to 18 hour fasting window each day. During this window, with no dietary glucose incoming, the liver is forced to shift its fuel source. It begins oxidizing its own stored fat. This is the biological mechanism by which fasting directly reverses hepatic steatosis, fatty liver at the cellular level. Protocol number 3. Choline and methyl donor support. Fat cannot exit a liver cell without a molecular escort. That escort is a phospholipid called phosphatidylcholine. Think of choline as the shipping label on a package of fat, and without it, the fat cannot be properly packaged and exported from the hepatocyte. It stays, it accumulates. Choline deficiency is one of the most underdiagnosed drivers of fatty liver progression. Sources include egg yolks, beef liver, and high-quality choline supplements. Methylfolate, methylcobalamin, and betaine support the same export pathway and are worth including in a comprehensive hepatic support protocol. Protocol number 4. Address the estrogen-insulin loop. If you're presenting with spider angiomas or Palmar erythema, your liver's estrogen clearance pathway is impaired. Support this pathway directly. Cruciferous vegetables, broccoli, cauliflower, Brussels sprouts contain a compound called indole 3-carbinol, which activates the cytochrome enzyme pathway responsible for hepatic estrogen metabolism. This is not supplementation for the sake of it. This is targeted biochemical support for a specific failing pathway. Protocol number 5. Track your mirror, not just your scale. From this day forward, your mirror is a clinical tool for you. Photograph your neck, your eyelids, your palms, and the whites of your eyes once per month. As you implement these protocols, your liver function improves, as insulin comes down, as estrogen clearance improves, as bilirubin processing normalizes, these signs will begin to resolve. The dark patches lighten, the spider veins fade, the palm redness reduces. Your mirror will show you the reversal before any blood test does. So use it. Here's the complete picture. 7 signs in the mirror. The liver belly, the dark neck patches, the spider veins, the yellow eyes, the eyelid deposits, the red palms, the skin tags are not separate cosmetic problems. They are actually a unified metabolic communication from one failing organ. The root driver is chronic insulin elevation causing fat accumulation in the liver. The reversal pathway requires 3 things: lowering the insulin load, activating the liver's own fat burning through fasting, and providing the specific nutrients, choline, methyl donors, and cruciferous compounds that restore hepatic function at the cellular level. Your liver can recover, but only if you learn to read what it's telling you. You were never meant to need blood tests to know your liver was struggling. The body has always been communicating in your skin, in your eyes, in the shape of your belly, and now you know the language. Now you can respond to it with precision, with the right protocols, and with the understanding that every visible sign has a biological solution. I'm Dr. Max, and I'll see you in the next episode. Stay healthy.